Like I mentioned, what I want to share with you all for the first 15 to 20 minutes is the study that we published. You can find it on the Health Affairs website, and the title is the same as this presentation title. So just starting off with some backgrounds that we're all on the same page, what do we mean by healthcare practitioner regulation? So regulatory agencies and private entities need to ensure that a practitioner has the required training, knowledge, and experience to perform as a qualified professional in the field. So in other words, regulatory regulations are important so that we can ensure high quality care for the patients that we serve. The process for healthcare practitioner regulation does vary vastly between state, and that generally includes licensing, credentialing, privileging, and certification. Knowing that these words are often used interchangeably, I wanted to first start with a singular definition of what do we mean by licensing. So licensing is that formal recognition by a regulatory agency or body that a person has passed all the qualifications to practice that profession in the state. The requirements typically include some sort of combination of education, training, and exam to demonstrate competencies. So licensing does not just include healthcare, it includes almost everything under the sun. But for the purposes of today, we're of course talking about healthcare licensing. So how did COVID-19 impact practitioner regulation and licensing? So the pandemic presented all of the states with a crisis that required swift action on many different issues, including the process for which we license healthcare workers. Temporary licensing or suspension of occupational licensing laws is not something that's new. It's been done before in response to other sorts of national disasters and public health emergencies. One that frequently is mentioned in this topic is Hurricane Sandy, was another example of when emergency licensing was used. Most states responded to the COVID-19 outbreak by activating many different types of emergency response licensure laws. Some used existing statutes and some others took new actions. Over the course of the pandemic, at least 45 states had enacted some form of temporary practitioner licensure waiver that would enable practitioners to work across state lines a little bit easier. So what was COVID's or New Jersey's response to the COVID-19 public health emergency? Well, in March of 2020, the state enacted a temporary workforce provision that included a number of different programs. Among those included a temporary emergency graduate licensure program, retiree license reactivation, federally deployed providers, international medical graduate licensure, and the topic of interest for this paper today is the Temporary Emergency Reciprocity Licensure Program, or the TURL program for short. So the TURL program allowed out-of-state currently licensed healthcare practitioners who were in good standing to obtain temporary licensure to provide services to New Jersey patients using either telehealth or physically in person. And the aim of the program was to respond to pandemic-related healthcare workforce demands, especially to accommodate the shortages that we were seeing at the hospital level and for underserved populations at the time. The TURL program was made possible and enacted through an executive order number 103 that was signed by Governor Phil Murphy in early March. And that order authorized the New Jersey's Division of Consumer Affairs, the DCA, which is what houses licensure functions, to, quote, waive, suspend, or modify any existing rule where the enforcement of the rule would be detrimental to the public welfare during the emergency. So what that actually meant was the order allowed licensing fees and criminal background checks to be waived for eligible applicants who are, again, in good standing. This executive order was something that was participated by with 23 licensing entities, which included boards for physicians, nurses, and clinical psychologists, among many other professions. This graphic I have on the screen highlights some of the key program dates And I'll quickly walk you through them. So again, in March 9th of 2020, that's when the executive order was put into place. And at that time, licenses were set to expire February 28th of 2021. Of course, the continually evolving nature of the pandemic led to many, changes to what we were doing with the TURL program. So in March of 2021, there was a new statement released that said that no new applications for certain underutilized groups were being accepted for the TURL program. But at the same time, licenses that were already provided were then extended to June 30th of that year. In early June of that year, the new statement said that no new applications were accepted for any healthcare professional group tied to the public health emergency termination in the state at that time. The division also created two groups of healthcare practitioners. Group 1 was extended until June, or continued to be stated that they would be deactivated by June 30th. For Group 2, which included multiple types of nurses, physicians, mental health providers, and respiratory care therapists, their licenses were extended through to September 30th. In September of that year, again, we were starting to see, increases in COVID exposure and infection related to the the Delta peak at that time. We saw that the DCA reopened new applications for Group 2, and those licenses were extended once again to be expired in January 11th. And in January of 2022, Group 2 licenses were again extended to July 1st, tied to the public health emergency being reinstated in our state. Moving us along to July 15th of 2022, the TURL program was announced to be discontinued and will end on August 1st for all of the groups except for respiratory care therapists. Licenses that were active at the time were then said to be active through to August 31st, with the option to apply into a bridge program that would make any temporary licenses move into a plenary license a little bit more seamlessly. And by plenary license, I mean more of a permanent licensure in our state. And then finally, respiratory therapists who had mentioned were continuing to be on the TURL program. Their licenses were said to be active through to March 31st of this current year, 2023. So a lot happened in the last couple years of the pandemic. And to give you some more context here, when we came in to do our survey, what you'll hear about in a few minutes here is that there were about 30,000 temporary licenses issued in early 2021. And, when I checked yesterday or earlier this week on how many licenses we had issued to date, there were about 53,000 temporary licenses. So this is a pretty significant number of healthcare professionals that were licensed to work in New Jersey, either via telehealth or in person, that we'd like to learn a little bit more about. So the reason for more licensure policy research, I think, is at least fourfold here on the screen. Healthcare workforce supply remains a challenge in New Jersey and elsewhere. This was an issue before the pandemic and continues to be an issue now. The pre-pandemic shortages were exacerbated by healthcare provider burnout, attrition, and we saw early retirement. Recent studies have also shown that current workforce pipelines are not going to meet the needs, especially for mental health. There's a growing interest at the same time from healthcare systems, practitioners, researchers alike on the impact of introducing more flexibility into state professional licensure processes. So that led to the work that you're going to hear about now, which was a study to explore who obtained the New Jersey temporary license, who used that license, and what were they doing with that license. Our findings, we hope, will help inform future professional licensure processes and strategies to help address the healthcare workforce shortages across the nation. So the study design for this work was a cross-sectional survey. We surveyed practitioners who obtained a New Jersey temporary license between March 20th and January 6th, 2021. And at that time, it was about 31,805 individuals. The time period of that survey was January 7th through the 21st of 2021. And the survey sample that we actually heard from was a little over 10,000 respondents, which was a 33% response rate. We conducted descriptive analyses by different practitioner types, and the practitioner groupings that we generated include mental health providers, which included the following types of providers listed on the screen: physicians, nurses, which included licensed practical nurses and registered nurses, nurse practitioners and physician assistants, respiratory care therapists, and then all else, which includes all of the practitioner types you see on the screen. So what did we find? The first question of who obtained a New Jersey temporary license, I just want to create some context here for some of the numbers that you'll see. The starting pool of individuals that we surveyed, that 31,805 number, this is what the distribution looked like. Among the survey respondents, we heard from about 10,000 individuals. We see a higher percentage of respondents who are mental health providers than what was in the original pool. So that's something to keep in mind, that mental health providers may be overrepresented in the survey response sample. And then we narrowed it down to those who actually told us that they used a temporary license, and that was about 7,500. So our first question was, what states were the respondents in the survey coming from? So when we surveyed them in January 2021, we were quite delighted to see that there were respondents coming from every state in the country, which is kind of a really nice thing to think about, that when we issued a call for help, we saw healthcare practitioners from everywhere coming in to say that they would like to help New Jersey residents. Among those states, we see that the top 5 states contributing healthcare providers were New York, Pennsylvania, Florida, Delaware, California. And the distribution and the colors that you see on the screen show that the proportion of types of healthcare practitioners coming from each state were generally the same, with the mental health providers, again, represented the most in our survey population. That's why you see the biggest bar there. But we see a lot of support coming from our states that are nearby, as well as larger states, including California. So who used, again, the New Jersey temporary license? In terms of the demographics of our respondents, I highlighted in yellow and in blue the groups that were the largest proportion of respondents. So most of our respondents are non-Hispanic, white, female, except for physicians, where we had a slightly higher proportion of males, and then either mostly 40 to 59 years old, except for the all else group, which skewed a little bit younger. So the respondents worked mostly outside of New Jersey, which signals to us that telehealth was utilized heavily by the practitioner groups highlighted in yellow on the screen. The practitioner groups that used the license mostly within the state of New Jersey were the nurses and respiratory care therapists, which made sense to us as they are most likely working within the hospitals in person. How many New Jersey patients did they serve? On average, the types of practitioners range from serving 1.4 patients among the mental health providers to recorded 409.7 patients with the respiratory care therapists. What was a significant number for us to see is that the license-using respondents touched over 1.4 million lives between March 2020 and January 2021 of our survey date range. What share of the New Jersey patients was new to the healthcare practitioners? We were curious about whether or not these practitioners were following their patients across state lines, but actually saw that 16% of our respondents reported that every New Jersey patient that they saw were brand new to them. The highest among these respondent groups were the respiratory care therapists, nurses, nurse practitioners, and physician assistants, who said that most of their patients were brand new to them. 31% of our respondents reported that none of their patients were new to them. Highest among those groups were the mental health providers, physicians, and the nurse practitioners and physician assistants who this suggests followed their patients across state lines. What languages did they use to converse with New Jersey patients? Most spoke only English when conversing with their New Jersey patients. But what was also really significant for us to see is that the respondents reported communicating with their New Jersey patients in at least 36 different languages, including the state's 12 most common languages that are listed on the screen. And in terms of the health equity standpoint, it's always great to see patients get more access to patients who are providers who speak their own language. What did respondents do with their temporary license? Well, we saw that 65% of them provided both COVID-related and other types of care, 29 only non-COVID related care, and 4% were providing only COVID care only. And how did the respondents get paid? So this was self-reported. Most of them were being paid by private insurance and using private insurance among the mental health providers and physicians. All else said that they were on salary for the most part. And then how telehealth was a big question among our group, and we saw that how often were respondents using telehealth. Looking across the different provider groups, many of them were using telehealth all of the time, especially mental health providers and physicians and nurse practitioners and physician assistants. It was less the case for the all else nurses and respiratory care therapist groups. And then what telehealth modalities were they using? And early in the pandemic, and the conversation continues now of whether the modality differs among different practitioner groups. So in orange, you see the all audio, and in green, all video telehealth. So the respiratory care therapists were the group that used most audio compared to other groups, and mental health providers were the groups that was the group that used all video more than all the other groups. And then finally, we were curious about why did some of the respondents say that they obtained a New Jersey temporary license but not use it at all? That was about 28% of our sample. The most frequently cited reasons for not using the license was they could not find new patients, they could not find a job in New Jersey at the time that they got the temporary license, or they were prepared to follow existing patients to New Jersey, but then the need did not actually arise. Other reasons that they reported were personal or matters related to obtaining the temporary license. Some quick limitations to note about the work that we did here is that the survey had a 33 response rate and overrepresentation of certain groups. So we can't ascertain what was going on with the non-respondents. The licensure usage was also all self-reported. The cross-sectional survey was conducted in January 2021. So the utilization of the licensure could have changed later on in the pandemic as the peak shifted from our part of the country to other parts of the country. And then the program was implemented early in the pandemic when it was concentrated in a few regions, including New Jersey. So related to my last point is that we can only assess the time point that we were doing January 2021. And if the program was actually implemented later in the pandemic, that may have changed the way that the licenses were being used. So a few points I want to conclude from this study is that our findings suggest that this New Jersey Temporary Emergency Licensure Reciprocity Program increased the state's workforce supply during the pandemic. The program also may have enabled care continuity across state lines and increased the supply of services for our patients, especially for mental and behavioral health. The temporary licensure of out-of-state practitioners, along with telehealth waivers, as we saw that was heavily utilized, may be a valuable short-term solution to mitigate workforce shortages during public health emergencies. But long-term healthcare solutions are needed because what's important to note here is that this does demonstrate a zero-sum game of practitioners moving from state to state. We're not creating new practitioners as a result of licensure waivers. Segueing into the panel presentation today is that something that may be worth exploring as like a short-term upfront mitigation strategy is multi-state licensure reciprocity. An example of that is, taking up some of the conversations recently is the Interstate Licensing Compact. Interstate licensing compacts allow practitioners to have one multi-state license, and that allows them to practice in both their home state and in other states that are participating in the compact. Practitioners who have this licensure compact will be subject to the laws and regulations of the state where their patient is located. They can also work without a declaration of an emergency and a waiver of licensure, such as the one I just presented on. And, just a quick landscape of what's going on in New Jersey. New Jersey has implemented a nurse licensure compact. It's also implemented the clinical psychology compact called the PsyPact, and it recently passed legislation for the interstate medical licensure compact for physicians. So we're excited to have panelists today talk about the implications for nurses, psychologists, and physicians with regard to interstate compacts.